worn down, but still not giving up hope.
A nurse who works in the IC unit here at Metro Health in Byron Center tells me she has an important message for anyone who's let their guard down since March when it comes to the COVID-19 pandemic.
But I think some of the most heartbreaking things coming from this is people who die alone.
Metro Health nurse Sue Bevier says that's a reality she faces more and more each day.
Having, your nurse be at the person at the bedside, being there while that patient passes or is scared. That's something I wouldn't wish on anybody.
Cases of COVID are rising rapidly in Michigan. Sue says she wants people to know it's still dangerous, even if they don't experience it firsthand.
But I feel like it has a lot more to do with people's perception of what's going on. I don't think they think things are as bad as it is because, nobody can really set foot in the hospital. No one can see the stress and the strain.
The fact is, half of her floor is now dedicated to intensive care patients. It's a heavy workload, unlike anything West Michigan has seen so far.
Mentally, it's tiring. Physically, I'm okay.
March, the first wave of the pandemic. But now in November, things are even worse.
I've been even personally told, this is what you signed up for. What did you expect?
Sue says she'll still do the work every single day, but wants people at home to do the work too, to help avoid healthcare workers like her from being the last person a loved one sees before they die.
Back in March, there were free meals for hospitals, a lot of merchandise being given out, and just a lot of social media support. Hey, we appreciate you. We're there for you. We're going to mask up for your protection. And I feel like things have slightly swung the opposite direction.
And so if there's one thing you take away from this story, it's that frontline workers are still doing the work they did back in March. They're just not getting as many thanks for them as they were back then. So if you do one thing tonight, say thank you to a healthcare worker. In Byron Center, Julie Dunmeyer, Fox 17 News.
All right, Julie. Meanwhile, health departments, of course, feeling the pressure as well.
In fact, some are being stretched so thin that they can't keep up with contact tracing. How they're communicating with those who may have been exposed.
Thanks for staying with us today. I'm Derek Francis.
And I'm Annie Satowski. A West Michigan Health Department seeing the highest number